This is News in Depth with me, Effie Mphande. Cholera is an acute diarrheal disease that kills within hours if left untreated. The disease is caused by ingestion of food or water contaminated by the bacterium Vibrio cholerae. In today's edition of News in Depth, we find out what measures are being put in place to eliminate the disease. Stay tuned. It is a deadly disease that can kill within hours of infection. This acute diarrheal disease spreads like wildfire from the time the germs enter the body. Though preventable, cholera is a devastating infliction. The method of infection is simple. It is by eating contaminated food or drinking water. Cholera is caused by the bacterium Vibrio cholerae. It is an old disease that has lived with man through the ages. During the 19th century, cholera is said to have spread across the world from its original reservoir in the Ganges Delta in India. 6 subsequent pandemics have killed millions of people across all continents. It is said that the 7th and current pandemic started in South Asia in 1961, reached Africa in 1971, and the Americas in 1991. Cholera is now endemic in many countries. In Zambia, the first known case of cholera was reported in Pulungu in the northern province in 1978. Since then, the disease has occurred in peri-urban slums where most of the marginalized populations live. In most cases, these areas have poor sanitation. The current cholera outbreak started in Kanyama compound on 5th February this year. This is the first outbreak in 6 years. Since then, the disease has been spreading. Bauleni is one of the townships worst hit by the disease. This is a restricted area, but my camera operator and I have been authorized to enter this zone. Dr. Gideon Zulu is the man coordinating all the activities in 3 cholera treatment centers in Lusaka. He shows me around. And inside the cholera isolation wards, there is no segregation. In short, there is no high or low cost ward here.
Looking at the situation from the past 48 hours, we are certain that I think we are slowly bringing this outbreak under control. We've seen a reduction in the number of admissions. Just yesterday we only had 2 admissions within Bauleni, whereas before when the outbreak started in Bauleni we were recording up between 10 to 15 admissions per day. So we are hopeful that slowly we are getting there in controlling this outbreak in Lusaka.
Which areas are the worst affected in Lusaka?
The worst affected area so far has been Bauleni. So since the outbreak started, we've had 264 cases as of yesterday. And out of those, more than 50% is from Bauleni. 172 of those cases are from within Bauleni. When we started initially, it was Kanyama. But then within Kanyama also we had people coming from John Lane and a few from Chawama and other surrounding areas. But now we've seen that within Kanyama itself, there are very few cases that we are recording. But the patients we are admitting, like at the Kanyama Cholera Treatment Center, it's those patients that are coming from surrounding areas, some from Zingalume, like we've had 2 from Zingalume, some from Lilanda, So it's the surrounding areas of Lusaka, but not at a scale that we had before.
Some cholera patients are accommodated in this tent. There is also a lot of activity inside the cholera treatment center. More cholera beds are still being made. The beds are made with a hole cut in the center. Waterproof sheeting is placed over the pallet while the hole allows stool to be channeled into a receptacle placed directly underneath the bed. Fecal excretions and vomiting are collected into buckets that are calibrated to monitor volume. But how is the cholera situation?
It is still worrying. As you know, we have more than 300, counting from the very beginning, more than 300 in Lusaka. We've had occurrence in summer, and but the one that was alleged to be the case in Chongwe was not actually a case. There has been the one no, I think it was not Chongwe. One of the places that was in Nyimba where it was said that it was a case, it wasn't. The Chongwe one is a person who we know traveled from Lusaka, and that is specifically from Kanyama. That is why it is important to trace the origins. So far, outside Lusaka, we do have those few, especially in the Nsama district. But that we are hoping that we can handle, because it's a very circumscribed community which we can deal with together. So we do have concerns still. We do have to work harder on the environment. Most important of all, every individual must ask himself, herself, am I maintaining a high level of hygiene? Washing hands before toilet, washing hands after toilet, washing hands before meals, ensuring that only safe food is eaten, not from any uncertain sources of food. That is, to me, the most important, the individual behavior.
Back at the Cholera Treatment Center, Martha Mwanza is one of those recovering from cholera. For her, this is one disease she wouldn't want to suffer from again.
Singayifuni because ifokesa mubiri kuli benchito amene ungagwire ungodayiria chape pang'ono ndikuenda ku toilet. Pang'ono nkuenda ku toilet manzi ekayika kuenda ku toilet. Kona diarrhea amene imangala ko yabwino noti diarrhea amene yabwera niwo yipisisa. Nangu diarrhea che kabiri manje ngutamangira che kuno ku clinic ba ku checking amene uliri. Kutamangira fasi abwera kukupasa ko waraisi wambera ko bwino nda kuchedwa kubwera kuno kozo kufa na time osala.
Sapape mwa dwala I disease, what would change? Nchanche muza chitako different manje.
Apa manje nangu manzi yokumwanza mbobirisa na ikamona na chlorine pa toilet nzambo ikapo buckets tasamba kumanja tikachoka mu toilet so that sizakadwale not sikadwale pofuti cholera.
So before mwadwala manzi mwenze kuchita boil nangu bwana.
Nizo boiling amanzi pamene nadwala nizo boiling na kamala chlorine.
Amukalibo dwala.
Pamene nzenga podwala nizo kumwa so chabe direct. Nizo kumwa so chabe direct. Pane batu pamene vanadwala ndi pamene tinamba no boiling amanzi tinaisi tingambukire maybe ka disease ngakhale kumanzi.
While we are at the Cholera Treatment Center, a man is brought in. It is apparent that whatever his affliction, it has hit him badly. From all angles, this could be another cholera case. But the main question is, how is cholera spread?
One of the ways, for example, that cholera can spread is someone with cholera who uses the bathroom has not washed their hands properly, and then we greet them. The bacteria comes in our hands, we touch either food or we touch our mouth, we ourselves get it, and that spreads. Or they come into contact with water, which everyone else drinks and things like that, and so it can spread. So one of the things that we encourage is that when there are cholera outbreaks, you should not have people gathering in big numbers, because where big numbers altogether the likelihood that the disease can spread and spread very quickly are very high. But also the other thing that we try and tell people not to do is to shake hands or to have a lot of unnecessary contact, because that way, as I have explained, is a way in which the disease can be spread from person to person. Having said that, however, I go back to say that above everything else, if we eat clean food, clean hot food, and water that is clean or processed. For example, if your water is not very safe, if you put chlorine in it, it will kill the bacteria, and you can drink it. Or you boil the water and you cool it, and then you drink it.
What is the government doing to prevent more people from getting the disease? This is the question I asked the Minister of Health, Dr. Joseph Kasonde.
Our measures are twofold. First and foremost, it is a hygiene issue, and therefore it's to do with the environment in which people are living. That is largely under the care of our colleagues in the Ministry of Local Government, and it is up to them to ensure that the environment is clean. As we all know, many towns in our country are not anywhere near the level of hygiene cleanliness that we would want, and so they're having to intensify their efforts to do that. But of course, as medical people, we are also concerned that when anyone gets it, A, we treat that person, but B, we go back to the history of how he got it or she got it.
Since 1978, cholera cases have occurred on an almost annual basis, with the exception of the years 1984 to 1988 and 1994 to 1995. According to the Ministry of Health, the cumulative number of cholera cases recorded between 1978 and 1989 was less than 2,000. From 1990 to date, the number of cholera cases reported annually has often exceeded 2,000. Zambia experienced the worst outbreak of cholera in 1991. There were fatalities too, and there were many reasons for that. Professor Everest Njelesani was permanent secretary in the Ministry of Health from 1987 to 1991 and now recalls how the pandemic was tackled.
During our time, the major outbreak that we had was in 1991, when we had really a big number of cases, well in excess of 13,000 cases. Unfortunately, at that time, the surveillance system, what we call integrated disease surveillance, was in its infancy. And so, but we had to work with WHO, with UNICEF and the other partners to put in what was the basic surveillance system at the time, case management, how to treat the cases, and then establishment of treatment centers close to where people were. That helped us. But as you can realize, it involves training health workers in every district, because the surveillance system means that you have to be prepared. You have to know how to pick new cases as they come through. And that also means how to respond in terms of health education, really trying to allay the anxieties. It's a serious disease, but you have to be calm, in order to guide the people as to what needs to be done.
That aside, uncollected waste keeps piling up on the streets of Bauleni. The uncollected garbage has even blocked some roads. Since the outbreak of cholera in February, authorities have been disinfecting communities affected by the disease. I had a privilege to accompany a team of volunteers to schools, bars and communities which they are disinfecting. But their efforts are being hampered by people's failure to keep their surroundings clean.
We have two areas that we are operating from. We are operating within the CTCs, the cholera treatment centers, but we are also in the community. So in the community, there are things that we are doing include the door-to-door health education to the community members. We are also disinfecting any contacts that we know when a patient comes here, we follow them up and see if there are any people they are staying with. We give them health education, but also we disinfect their houses. And like in Bowlen, also the pit latrines, we go in there and disinfect them. We've been also disinfecting the garbage collection points because that could be a potential source also for the cholera. In the community also we are giving out household chlorine to the communities to use for their drinking water. We are also advising them to boil their drinking water.
In the townships affected by cholera, we have been finding out what people know about the disease, and this is what they said.
You know, to kick away cholera, we are not supposed to wait for the government. Each one of us have the right to kick the cholera.
Cholera yabwera muno mwa Bowlen. So madoti niona aona bachita kuipa bazimai. Sebata binyala manyumba basunga doti.
Okay, nizibati imabwera na vimanzi va doti. Pamene batayamo marabishi vijanje pamwamene imachokera cholera. Ero kushekina na manja na uja mundu achoka ku toilet ungadwale cholera. Nina mbera hapo ati imabwera na mpepo ati nkati kuli wamene adwala cholera na imwe muri pafupi mungakali affected.
Cholera ni airborne disease.
Cholera comes when the surrounding is not kept clean, especially this rain season. As you can see, the drainage is there. As you can see, women are throwing diapers anywhere and throwing garbages.
Later, I caught up with Dr. Constantine Malama, a public health specialist from the Ministry of Health, to find out what it is that people need to know about cholera.
Most important, it is the fact that it is a disease which can be both controlled and prevented. If people take basic steps like making sure that they always take in clean water, and they drink clean water, they use clean water for washing their plates. Basic hygiene like washing their hands after they use the bathroom and before they handle food.
Zambia has been struggling with cholera for about 38 years, and the reasons are not far-fetched. Here in George Compound, people still draw drinking water from wells. Nearby, there is a pit latrine.
What we've seen is that in these two areas, the major issues is water and sanitation. We have households that actually have no basic sanitation, and I mean a toilet. Some of the areas are overcrowded, and in that case you'll find that maybe a household of 6 is sharing a toilet with the 2, 3, 4 other households, of the same population. And so you'll find that the sanitation is not adequate. Apart from that, in Kanyama we have wells, shallow wells. And shallow wells are mostly contaminated. We have had water sampling in most of these areas, and most of the water in Kanyama, and indeed even in Bowlen, are actually contaminated. And so we are hoping that people can boil their water or add chlorine to their water so that they can treat the water before they drink. That will help us to control this outbreak that is running.
The Chief Environmental Health Officer had many recommendations to make.
We need to ensure that the shanty compounds, including the urban areas, we have adequate water that is easily accessed, easily affordable to the people that need this water. The other thing is that sanitation. Our sanitation is still below 50%. And so we need to ensure that everyone has access to adequate sanitation, including the peri-urban areas, what we call the shanty compounds. Because as long as we are not going to have sanitation in these areas, we'll continue to have cholera.
The Public Health Act is very clear on sanitation, but is it being enforced?
In fact, we're having some discussions to ensure that the council, because that has to be policed through the local authorities, so they have to ensure that their planning departments or planning authorities are effective in terms of monitoring. Of course, you know the areas. The council would know where their areas are and where they are locating plots, but there are also other pieces which are not directly related to the council, but that is where now we have the planning authority for the province. In this case, we are talking about the Lusaka province, or provincial planning authority. All those plans within the province have to go through the planning authority for approval, and in there they look for compliance with specific issues to do with sanitation and the way those structures will be done. There's a lot of scrutiny that goes in.
What challenges is the government facing in containing the spread of cholera?
If we are going to clean up the streets, we have stepped on some feet in that process, and it's up to us to negotiate so that we arrive at an acceptable level of cleanliness. So the main constraint is when people see themselves as suffering from the measures we are taking, and it's up to us to explain that they are not meant to be suffering.
During my visit to the local WHO office, I was also keen to find out the health body's assessment of the way the government has handled the current outbreak of cholera.
To the best of my knowledge, the government has done its best during this outbreak. However, prevention is better than cure. What one realizes immediately is the government. If the government and the health sector together have been doing what they are doing now, surely we won't have cholera. So it's a case of firefighting. If you look at the garbage disposal in all the areas where the outbreak has spread to so far, you will actually have the impression those areas where the outbreak has not gone to, it's just a question of time, because what you find in Kanyama, in Bauleni, Mtendere, is found in other areas. So what we urge the government to do is to continue the good work they have started now and do it every day, every week thereafter.
Back to Bauleni, a water bowser is distributing water to residents for free. The government says this is a temporary measure as a lasting solution is being found. But many here are asking the government to stop rationing water.
How do we kick out cholera if we have no water? So government should look into it, because we can't have one truck delivering water to the whole lot of Bauleni. That's not okay.
So how many containers of water do you get per day from these trucks that are going around?
Since we are so many here, everyone wants water. Sometimes we end up getting one bucket of water. How do we work with one bucket of water? It's not working, especially with kids.
The government is also taking other practical steps.
As you know, in some of these localities, there are those water kiosks, and people access water there at a fee. So decisions had to be made to ensure that we increase on the frequency of the provision of the water in those affected areas, and also ensure that this commodity is accessible, because as it is now, there's a minimal amount that is paid, and so this amount is being absorbed by DMMU. Our brothers and sisters in those two areas, particularly in Baulen and Kanyama, have got an increased supply of water, which they are accessing without difficulties, because one of the conditions before this tragedy was that they had to pay some minimal fees, but we know that others could be subjected to hardships if they don't have, because in some families, even just to get 10 kwacha is a big issue.
Since the outbreak of cholera in February this year, many have come on board to help Zambia combat the disease. The World Health Organization is one of the organizations working with the government to combat the disease.
The World Health Organization is working with partners to support the Ministry of Health and in general the health sector in combating the cholera outbreak. The activities all partners are involved in include the very basics: social mobilization, education of the communities in terms of how cholera can be prevented.
But Zambia may be far from eliminating cholera. In fact, it is a complex issue because many new residential areas have their own soak-away facilities, which environmentalists say may contaminate underground water if not properly built.
There are some investors who are having discussions with us as a ministry to see how through us, they can work with the Lusaka Water and Sewerage to implement that, to ensure that there is connectivity in all these areas. But the challenge has been that most of these are not going through the planning authorities, and so they are coming up with their own plans which they are implementing, and so the government has to come in at the last stage when the difficulties start to be experienced. And so the ideal situation is that before people plan their new buildings, they submit their plans for scrutiny and approval before the provincial planning authority. And then once that is done, there are certain things that the planning authority will check for. If they are not there, they insist that they are there, or if they are there in a wrong way, they do the correction, so that once they implement, everything is as they should be, to avoid the calamities like we're experiencing today.
Experts and authorities had their say too.
The simple rule which we communicate to everybody regarding food and general hygiene is boil it, peel it like a fruit. If you can't boil it or peel it and you don't know the source of that food, just forget it.
Our duty is to ensure that, as government, is to ensure that we provide clean water, safe water, both to the rural and urban areas. And in this regard, a lot of work is being done through the cooperating partners. Thousands of bores are being sunk as we speak throughout the 10 provinces.
Most important of all, our aim is it must be eliminated. But we can only do that if the individuals join and if the community joins in accepting the simple principle that this is a waterborne disease. Therefore, water going down any throat should be safe, clean, and clear of any of these bugs.
Cholera is a disease fueled by filth, muck, waste, and all the grime that you can think of. This is why only cleanliness can keep this disease at bay. Well, that's all we had for you in today's edition of News in Depth. We're looking at cholera. Please ensure that you boil your drinking water. If you can't boil it, at least add chlorine. Join us next week with another program. From me, Effie Mphande, and the rest of the team, it's goodbye and God bless.